Come on through, Jeffrey. So we had a chat about this yesterday.
Yes.
Saw you in November, December, when you had this sort of tightening of the foreskin.
That's right.
But you could get it back, and I referred and it got rejected.
Correct.
But since that time, it's got worse.
Definitely.
And what can you do? Can you retract it back to go for
Not
a
at
wee
all.
or anything like
Not
that?
at all. There's no retraction at all. And it's getting a little bit embarrassing because obviously there's no direction.
So does your wee come out does it spray at all or?
Yeah.
Okay. Okay. And is there any skin change on the tip of the penis that you can see?
There's colour change.
There's a colour change.
Yeah.
And when did that develop?
Well, it's been developing since it hasn't been able to retract.
Yeah. Yeah. Okay. Sorry, Jeffrey. I just
That's all
need to. Can you see what you can retract yourself?
Yeah, sure. There's nothing at all.
There's a whitish skin change there, though,
Yeah.
isn't there? Yeah, fine. Okay. Let you pop your things on and get dressed. That's okay. I think you've dropped a couple of copper pennies there.
Oh.
Right. Well, obviously it needs sorting out. I think what's going on is something called BXO, which is a kind of skin condition that over time in your sort of age group leads to just the tightening of the foreskin, exactly the kind of symptoms you describe.
Yeah.
And so that needs acting on pretty quickly, actually. Haven't seen a case for a while, actually. BXO stands for balanitis erotica et obliterans, and it causes thickening of the foreskin and depigmentation. This presents with symptoms of poor stream when you're passing urine and pain during intercourse. It's relatively uncommon, we don't see it very often. Medical options are using steroid creams, which sometimes help, but unlikely in cases where they're occurring in older age groups. Usually the definitive treatment is surgery, which is often a circumcision procedure. Does it itch at all?
Every now and again, I get that really it itches inside.
Yeah.
And you can tell it's quite hard skin at the top end.
Try and keep the area dry. The other thing is just to book in for some blood tests. I just want to check your sugar level and a few other bits and pieces because you haven't never really had any blood tests.
No.
So if you take that along to the treatment room, they'll book you in.
Yes.
I'll speak and sort out the urology referral again.
Yes.
See what we can do, but it's more urgent now.
Yes.
Remind me, do you smoke at all?
No.
You've never smoked?
I gave up when I was 10.
You gave up when you were 10?
Yeah.
Should I ask how old you were when you started?
About 8.
Were you just trying it or smoking proper?
No. My friend and I used to go down to Central Park in Plymouth.
Right.
Because my dad was in the Navy, so there's 60 a day, so there's cigarettes everywhere.
It was freely available.
So we used to just go into the park with a packet of 10 and a bottle of lemonade.
Then muck around.
And then when I was 10, Steve decided to drag one down, and I thought, no, I didn't like that.
Didn't like it, so it put you off for life?
Yeah, definitely.
OK, well, there we go. All right, Jeffrey.
There's not too many people who say that.
No. I'll speak to you a bit later.
Brilliant.
All right, we'll get that sorted ASAP.
Lovely. Thanks very much for that. Brilliant.
Take care.
Thanks a lot.
Bye.
Right, now.
Today I went to school to pick her up early because she told her teacher that she has got pain in her private, and they were saying maybe it's a urine infection, so I brought the urine sample here.
Very good.
Yeah, so...
But I saw you nearly 4 weeks ago with
I think
tummy
it was
pain.
2 weeks ago. Yeah.
And you were feeling sick and the pain was in the middle here. Is this the same or is this something different?
Something different. So on the weekends, on Sunday it was starting to hurt, but on Monday it was like I was feeling more pain, and then on Tuesday when I went back to school it wasn't hurting, and then today it was starting to hurt.
Okay, yeah.
Well, let me check that and then we'll see. Have you noticed Kira getting weeing more often or getting up at night to go or anything like that?
No, actually she doesn't wake up at night to go to the toilet for weeing. But she's been complaining about pain in her private. It's been 2 weeks now, so I
yes.
think she has got it.
Yeah, I think she has. Now have a look at this. You see that one there has gone really purple. That is a sign that you've probably got a water infection.
Yeah, water infection is my third.
Any pain anywhere else?
No, just only this part.
Do you want to just lie on my couch for a minute? Let me just feel your tummy.
Okay.
How old are you now?
9.
9.
Yeah,
OK. Show me where the pain is, can you?
this part.
Oh, it's right down there in the poor old... OK. Poor you. Up you get. Well, at least we know what the diagnosis is, probably. You need to take 2 teaspoonfuls 3 times a day.
Okay.
We'll send that to the laboratory and that'll tell us if it definitely is an infection. And then the other thing is they'll look and make sure that this is the right treatment, the right antibiotic. So that's exactly what you had last time.
You have to take this to school.
Take this.
No, the
Okay.
medicine, okay?
And then if all your symptoms don't get completely better, we should see you again next week.
Okay.
Well, you'll feel much better in a minute as soon as you've had some treatment. Is that all right?
Yes.
OK,
Thank
and
you.
it's a pleasure to have you.
Thank you. Have
All
a
right.
good day.
Bye-bye.
Bye.
Come on in.
Hi there. About a month ago, I think I came very close to a heart attack.
All right.
It was as though somebody was hitting me in the chest for about an hour.
Mm-hmm.
I had to sit down for an hour, and after that, I was still shaky for about 2 hours.
Oh, gosh.
And I suppose you heard about the fire.
I haven't really heard about the fire. What?
Well, our next-door neighbours decided to have a burning session next to a wooden fence. And an ember caught on our shed. Our side of the house caught the entire flame because the wind was coming that way.
Gosh.
We had 80-foot flames and 2 tenders. And I suppose you heard about the fire. We lost 2 cats.
Oh, how horrible. What about the rest of the family? Was everybody all right then?
Well, fortunately, most of the other kids were out.
How terrifying.
Yeah, it was. I mean, there was just nothing left.
Yeah. How are you feeling about everything?
Well, I'm still shaky.
I'm not surprised.
I mean, I've lost about 1.5 stone.
Can we help from a health point of view with anything in the
Well-
aftermath after that?
Well, Lynn and I both need full prescriptions, please.
OK, I'll give you some more medicine. When you say that you were worried that you'd had a heart attack,
Yeah.
what was the pain like?
Well, it was like somebody just hitting me in the chest with a
Right.
fist.
And then it stayed for a couple of hours, and then it went away?
Yeah.
Do you get angina regularly when you walk?
I get the odd one if I walk a bit too fast. But
OK, but this was a permanent chest pain that was there all the time. Because you had an echo,
Yeah.
and they said that that all looked normal. I guess one of the challenges here is if it happened a while ago and it's not happened since, what do we do about that? It's probably worth us repeating your ECG and the blood test just to double check, because if it was positive, it would change what we did.
Yeah.
But otherwise, I wouldn't want to say what had happened at that point with certainty.
Yeah.
What I would say, though, is if you get chest pain like that again, it's really important that you call an ambulance, because it could be a heart attack, and that might be something really serious. Obviously, that could be fatal if you had an ongoing heart attack that you didn't do anything about. Let's have a look, then. Well, your blood pressure's lovely and normal today. Just listen in here. Your oxygen level is OK, and the pulse is OK, and everything else seems normal.
Right.
And then I'll see you in a couple of weeks to follow up.
Right, lovely. Thanks
All right.
Right, thank you very much.
Bye, then.
Bye.
Hey, do come in. You all right?
No, not really.
What do we need to discuss?
It's my memory.
Okay.
I had a row like with the missus last night over some stupid thing. And 20 minutes later, I didn't know what the row was about. And she asked me to put something by. I put it by. Then she asked me then a couple hours later, well, that thing I gave her, where do you put it? I can't remember where I put it. You know, it's things like that.
Is this something that's come on fairly recently, do you think? Or
Well, no,
has it been going on for a while?
I've been going, for a while, like. I mean, I told her...
I think I've had a previous letter from the hospital where someone
told
said they were a little bit concerned about your memory.
I told a specialist, and as you know, I've just seen her. And she said your memory loss and what you call is probably due to depression, whereas you worry about your mother's death, you worry about your memory, you know. Well, I do get depressed.
So I think there was some concern about your memory before your mother's death,
Yeah.
wasn't there? Actually?
Yeah.
Have we done a memory test with you at all?
What was that?
Just a test to try and assess actually how bad your memory is. Have we done a check at any stage?
No, I haven't. I can't remember it.
Can't remember
I did.
one. I was about to say that, but you said it for me. OK, should we do that today?
Yeah, it's fine.
OK, and then we'll chat about where we go next. So I'm going to give you a name and an address to remember. OK.
Right.
The
Not
name,
too long, though.
Not too long. John Brown, and he lives in 42 East Street, Bedminster.
42 East Street, Bedminster.
OK, give me the whole name.
John Brown.
Yeah.
42
Yeah.
East Street, Bedminster.
Super. OK, I'm going to ask you that again in a minute. All right?
Right.
What was that name and address I asked you to remember?
Brown.
What's his first name?
Brown. East Street. I can't remember.
I can't remember the chap's first name. Do you remember what his address in East Street was?
No.
No? OK. And do you know where East Street is?
That's Bedminster, isn't it?
Bedminster. That's right. You're very good, yeah. OK. Now, without looking at the watch or clock or anything, can you tell me what the date is today?
No. 10th.
10th of what?
Of June.
OK.
Yeah.
And the year?
2017.
OK. OK. All right. Now, a little drawing exercise here now. This is a circle. OK.
Yeah.
I'd like you to imagine that that is a clock face. Can you put the numbers around the clock face for me? OK. Now, if the time was 10 to 2, where would the hands be? Could you draw the hands in on your clock?
10 to 2. 10 to 2.
Have you? OK. That's the end of the memory test. There were some gaps in your memory. I mean, obviously you struggled a bit with the fella's name at the end, John Brown.
John, that's it.
Yeah.
Yeah.
And you did struggle a bit with the clock, actually. But
12? What?
well, no, but not putting the numbers around the dial. I don't know if you...
Oh, right round, you mean?
Yeah.
That's why you do it, like that.
Yeah. I would say that means there are some issues with your memory. I mean, it'd be quite good to have a chat with your wife sometime and see how she perceives it.
What she reckons is I'm close to dementia. I just go into dementia. Okay. It's stupid, isn't it?
Okay. But I'll have a chat with her sometime. What we normally do if people have got problems with their memory is there's a set of blood tests that we do, which just occasionally help us to know what's going on. We normally get a scan done of the head as well, CT scan of the head. I don't know if you've had a CT scan for your epilepsy at all, have you?
No. I've got so many tests I can't remember.
And it will also be useful from an epilepsy point of view as well. So we get that scan done, we get the blood test done.
Yeah, I've had a few fits.
Yeah. And it'll be useful to meet with your wife next time, actually. Book a double appointment and come with her. Right. All right. You'll get an appointment through the post for a scan.
Thank you.
OK. And when you've had the scan, give it about 10 days and then book an appointment and come with Liz for a double appointment.
Right.
OK?
Yeah, thank you, Doctor.
Jolly good. Okay. Bye-bye.
Hello,
Hello.
I'm Dr. Bolam.
Good to see you.
Right.
A week back, I was here.
Yeah.
I was suffering with every year almost a fever.
Okay.
Apart from that, I'm having asthma.
Yeah.
So it's getting worse and
Oh dear. Okay. All right. So you think this is really your asthma, or a combination of the
combination,
asthma? Okay.
yeah, because
all right.
it triggers with. I mean, asthma It's in control.
It's not in control at the moment, is it really?
Almost every summer.
You always get a bit of a dip.
Starts with hay fever.
Okay, and then you're
ends
asthma.
up. Last year I was been to the emergency. Then my GP. He said like we'll try with antihistamine, which I'm trying over the counter.
Yes. Okay, so. Okay, so what you're wondering, I mean, I'll have a little look at you in a minute, but what you're wondering is whether you need the steroids.
Absolutely. That will be immediate relief and controls life.
Okay, well, I will anticipate we'll do that, but let's just check. Okay.
Okay.
Can I just pop this on a finger? And you're not coughing up any spit? You don't think you've got an infection or anything?
Spit in the sense, white stuff sometimes coming. But
Yeah, but nothing green or not mucky looking? No. All right, OK. And what job do you do?
I'm an IT programmer.
OK, right. Can I have a little listen to your chest? Is that all right?
Absolutely.
Thank you. OK. OK. I'll wait till that's finished. You're a bit wheezy, aren't you?
Yes, absolutely.
Do you have a peak flow meter at home?
Yeah.
Might be better to stand up. Let's just have a look what your normal peak flow is. Do you know what it is normally?
I'm sorry, I don't remember.
I feel like coughing now.
It's not contaminated. I don't think it's contaminated.
I don't think you contaminate. I think it's psychological. So the last time you did it was 420. OK. I'll have a quick glass of water. Just blow it over that direction for me.
Oh, I just hold it.
That's better, I guess. No, 260. All right, so that's a bit lower than you were last week when you saw the nurse, all right?
Yeah.
OK. OK. I'll give you some... so the best you did there was 270. All right. If I was you, I think I'd be carrying water around with me. I think water would help a bit, wouldn't it?
Yeah.
Maybe we need to step up your treatment. There are options, but you think it's well controlled most of the year, and it's just bad in the hay fever season, really?
Season in summer.
OK. All right. Fine. I don't want to step it up permanently if it's normally all right.
Yeah. Thank you
OK?
very much.
All right.
Cheers.
That's a pleasure. OK. All right. Take care now. Thank you.
Thank you.
Bye-bye.
Hi.
Hi.
What's been going on?
I fell down a rabbit hole.
Oh dear, right.
My ankle went up. I heard it crunch and pop and...
Right.
So I've just been getting on with it, but it's not getting better and it, you know, I can't bend it. You know, like when you sit on your foot,
Yeah.
I can't do any of that.
OK.
So I think there is some...
And were you able to walk on it at the time?
Oh, well, it was a struggle getting home.
Yeah.
But yeah, I've just sort of like pushed
Just kind of
through
got
it.
on through. And what have you been using for it?
Nothing.
This was which day?
Right, 7 weeks ago.
7 weeks ago?
Yeah.
So what's brought you up tonight then?
Well, it's just not getting better.
Yeah.
I am going on holiday on Tuesday.
OK.
So I just wanted to check before I went.
Yeah, because I think, you know, if you did sprain your ankle,
Yeah.
which is what probably has happened, then it does often take months to get better.
Yeah.
Is it sore at all?
Yeah,
Not-
it's more here.
Not round the back, though.
No.
Move it round and round.
It's there.
This is where it's sore. Yeah,
Yeah.
that's where it's painful. Because that's the classic spot where you get a sprained
Yeah.
ankle.
Ah, I
Is
can't
it
see
sore
that.
on your foot itself?
No, it's there. I'm going to bend it.
What about in here?
Yeah. I'm trying not to cry.
But it's more in here rather than in there.
Yeah.
It's more in the over the foot.
It's all of it.
I mean, I think most likely this is just a nasty sprain that you've got. It can put people on crutches, so just because it's a sprain doesn't mean it's not serious.
Yeah.
And it does mean that it can go on for months. It can be worse than a break because actually the ligaments heal up less quickly. Because it's actually more over the foot, though, I think it is reasonable to get an X-ray.
Yeah.
I will arrange that for you to go up and just go and have that.
Drop in.
Yeah. Do you want some painkillers?
I've got painkillers.
You've got some.
Yeah. Is that just any day?
Yeah, 9 till 5,
Friday.
Monday to Friday,
9 to
so you can
5.
go up tomorrow.
Lovely.
And then why don't you give it a week and then ring just to get the result?
Yes.
All right.
Thank you so much.
Cheers then.
Hi.
Hopefully it will just,
Oh, I
there won't be
think
anything
so.
there, but if there is,
Yeah.
then we'll do something more about it.
Thank you very much.
OK, bye.
Bye.
Come on in, come and take a seat. Right, I'm Dr. Ahmed. How can I help today?
For about 3 or 4 weeks now, I've just been getting a flare-up of eczema.
Right.
And it's just not going away.
Okay. And have you had eczema since you were a child?
Yeah, and it just flares up when I'm stressed and overtired.
Any reason why you're stressed at the moment?
Yeah, there's a few reasons, but they're things I'm dealing with, so
Okay.
work and stuff.
What work do you do?
I'm a ICU staff nurse.
Ah, okay.
Yeah.
How are they treating you up there?
Oh yeah, it's fine. It's just the
Work
type
pressures.
of work, yeah. You get some sad cases in and affection more than you realise until you get home.
So do you have sort of strategies in place to switch off from when you come back from work?
I live with 10 people, so I switch off pretty easily when I get home.
So there's plenty of people to
Yeah,
talk
there's
to
yeah,
and things like
yeah.
that. I think that's the main thing, is to talk about it, because you're
Yeah.
involved with those cases, aren't you? Do you know about Bristol Wellbeing Therapy? It's just an independent...
I've seen the
Yeah.
one now, like intranet thing.
Yeah, just if you want an independent source of counselling, if you wanted it, there's some information there, and you can do the form online.
Thank you.
And sometimes they just do random workshops that you might be able to attend, and it's just an outlet, really,
yeah.
for the kind of work that you do. You don't smoke, your alcohol sort of intake's fine.
Yeah.
Let's have a look at it.
So it's
just
always
that.
patchy.
Yeah.
So it's there and there. And then
Your face
there
is
and
all right, isn't it?
It's
Backs of
normally
the
around-
knees? Or?
No, I was hoping to give blood next week, but I don't think they're going to let me now, so...
Okay. So I'm going to just do a prescription of hydromol. And at the moment, with the way the eczema is just on the arms, you don't need a strong potent steroid, maybe just middle of the range.
Yeah.
And I'm wondering if on the same prescription, because I know it's difficult for you to get in, if I just put some 1% hydrocortisone,
Yeah,
which is milder, then you can step down.
Yep.
Anything else I can help with?
No, that's great, thank you.
No, fine. Okay, so the eczema we'll get on top of, but longer term,
Yeah.
we need you in the NHS for a long, 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 long time.
Yeah.
So I need to look after you. Okay.
Thank you very much.
That's all right.
great.
Nice to see you, Bethany.
Have a nice day.
Thanks. Take care. Bye.
June Wilkinson.
We passed you once, I'm sorry.
My name's Dr. Hutt. What can I do for you?
For a long time now, I have cramps in my leg when I go to bed.
In your legs, okay.
Really bad.
Okay.
It's so bad. You wouldn't think those big toes could stand up solid. You can't even bend them.
Okay.
It's vicious.
And is it just at night?
It's just at night time. Sometimes I get it in my groin here, but I can put up with that. It's when the legs start.
Okay. And does it wake you up?
It don't even let me sleep.
Okay.
It's really bad. Just don't look forward to going to bed. As soon as I lay down and I try to creep into bed to pretend my legs don't know, you know, I lay down and then it starts. It's like icy cold water running down my legs.
all around it.
And then it sets in.
What helps? What have you tried anything?
I've tried something. I got something from Health Shop. I did a fetch it when they were there.
Have they made any difference, has it?
From Health Shop.
Okay. That's not made much of a difference, has it?
Nothing at all, no. This is second bottle.
Okay. What's your diet like? Do you eat like...
I eat plenty.
And do you eat dairy products and milk and cheese?
Everything you can imagine.
Yogurt and all that.
I've got a massive appetite.
Any swellings or anything? Can I just have a quick feel?
No.
Just have a quick feel, all right? No pain when I'm pressing?
No. Just the silly old cramps that I keep getting really bad.
Cramps are quite common. We do see it quite commonly, like, you know, people complain, especially at night time.
Yeah.
And it's called night cramps. Now, sometimes if there's some deficiency, like lacking vitamins, or even if it's lacking calcium or vitamin D, things like that, they can give you cramps. I would like to check your calcium, your vitamin D, and some vitamin B12 and those sort of things, and make sure that you're not deficient in iron in any of those that could be contributing to your cramps. How does that sound to you?
I'm chuffed if it's better than that there.
So what I will do is I'll write down what blood tests we're doing, and on your way out, if you can just book in with the nurse for a blood test, and then I'll see you back with the results. Of the test, and see how you get on with it. If this is not helping you, then just don't take them. If they're just magnesium, so see
Seem
how
a waste of time then.
Yeah. Is that okay? So
Right.
anyway, nice meeting you.
Thank you.
I'm coming, Pat. I'm coming.
How are you?
No, not too bad, my love. Thank you very much. Yourself?
Yes, I'm fine, thank you.
Good.
Even better at 5:30 when I'm done.
Well, yes, indeed.
So, you were only taking amlodipine 10 milligrams?
but your blood pressure was still raised. Thank you. You've been bashing yourself.
In actual fact, yes.
What did you
Basically, I opened the car door and the corner of the top of the car door was smacked right in it.
Oh, dear.
It was painful, I'll tell you straight, it was.
What about the reason that you stopped taking all these tablets were the night sweats? Are they staying away?
I think so.
Good. What's your plans today?
I've got to go to a garden centre to get some fish.
All right.
It's a blue koi.
Very nice.
Yeah, but no, not for me. It's
all right.
A replacement for my friend who's on holiday and unfortunately the sun got to him. Virtually boiled him, which is not nice.
Were you looking after him now?
I nearly cried when I saw him. I'm supposed to be looking after him as well. It doesn't help, does it?
So you're going to complain and tell them the truth, the whole truth, and nothing but the truth?
Well, I didn't do it. It's the sun that boiled him, not me.
You're not just going to pretend that they're all OK?
Well, no, he was rather really fond of these fish, and I'm trying to get him some replacements before he comes home, because he'll go absolutely mind-boggling crackers if he finds them missing. And it isn't my fault, obviously.
No. OK, your blood pressure, average, is perfect.
Oh.
So we need to just leave your meds as they are now. You all right with that?
Indeedy, yes.
I hope you find the fish.
OK, my dear, thanks ever so much.
You're welcome. Let me get this door for you.
Yeah, indeed. I'll see you later, Pat.
See you later. Bye.
Now. Bye-bye.
Right, so I'm Dr. Khan. How are you?
Yesterday, people kept saying to me, what's up with your eye? I didn't know. During the night, this part was really hurting because I asleep on that side.
Yeah.
And it's burning.
OK. Any problem with the vision out of that eye? Does it feel the
Not
same?
that I notice, really. And I think it's watering, but it isn't.
Let's have a look. Do you mind if we just take the glasses off? I'm just going to have a closer look at it. It is very red, isn't it?
Yeah.
OK, so if you look up at the ceiling for me. And just down at the floor. And then up again at the ceiling. OK, and I'm just going to do some tests on your eye. If you just follow my finger with your eyes only.
Yeah.
Any pain in that eye when you're looking over to that side?
It's just burning. Not any other... Yeah, same.
OK. Right, if you just put your glasses back on, and then if you just cover your good eye with that side, what does your vision feel like there?
It is a bit blurred compared to normal.
OK, I just want you to keep looking at me. When I move my fingers, I want you to say yes. OK. We're going to try the same on the other eye, so just do that. And then look at me again. When I move my fingers, say yes.
Yeah, I can see them now.
When you've got pain around the eye or any burning, it suggests that the bleeding is going from the surface of the eye but to behind the eye as well and inside of the eye. That can cause pressure to go up inside of the eyeball, because the eyeball is a nice kind of ball and it's full already. There's no room for anything else.
No.
And if there's any bleeding, extra fluid inside of there, then it starts to raise the pressure, and that can really cause problems with your vision.
Yeah.
The pressure is already getting to a point that it's damaging the nerve in the back of the eye. So we need to get you seen urgently today by the eye specialist.
It felt better, but this morning, well, I woke up a few times during the night and I had this pain down the side, burning, and I thought, well...
I'm just a bit concerned you might have this other condition called an acute glaucoma, where all of a sudden the pressure raises in the back of the eye and causes that nerve problem. Nobody really knows why it happens. There's lots of different theories, but we don't know why.
Like that.
It can just happen. Ladies are more prone to it, unfortunately. Let me ring the eye hospital. We'll get you an appointment there. They'll see you today. Oh, I'm so glad you came today, because any kind of pressure in the back of the eye can lead to permanent sight loss if the nerve gets damaged really badly.
I've never had anything like
No.
And that's my best eye.
That's your best eye, so we need to keep it your best eye.
Yeah.
You're the most unwell patient I've seen today. I know you don't feel unwell, but this is a really serious condition, so we've got to get you seen by the eye doctors ASAP. Hi, my name's Dr. Khan. I'm calling from the Ridge Medical Practice. I've got a lady who's 74 years old. She's coming with an acutely painful left eye. It started yesterday, red bloodshot. She's got painful eye movements, pain inside of the eye and above the eye, and a burning sensation on the surface of the eye. On examination, the pupil on that side is sluggish to respond to light, and she's lost her visual fields on that side as well. Pretty worried about her, to be honest. Will it be today, though, her appointment? I'm really reluctant to let her go home because even while she's sitting here, her vision is deteriorating. We need to get you seen today. I won't take no for an answer, don't worry. If it's all right, I'd rather her not leave the building until I've heard from you because I need her seen today. Yeah, so will you call me on my mobile the minute he's free? Yeah, all right, thanks very much. Cheers, bye-bye-bye. Mrs. Cowley, I'm going to have to hold you prisoner here.
Oh.
No, the eye doctors are in theatre with another patient.
Yeah.
I don't want you to go because I'm worried that minute by minute your vision will get less and less.
Yeah. Thank you.
Sit down. So, the eye doctor's rung me back. He's equally worried about you. He's in theatre all morning today. He's booked you into his clinic this afternoon at 3:30.
Where is this at?
At the BRI. I'll write it down on here. They're going to see you urgently, and if you take all of this with you, it's got the letter that I've written.
Right. Have you done all that already?
I have. Very organised.
I'm watching you.
So just take an overnight bag in case they decide to keep you in hospital.
Okay.
So take all of that with you, and then once everything's fine, will you come back and tell me how it went?
Will.
Yeah, I'll be interested to know.
Thank you very, very much.
My pleasure.
Thank you very much.
My pleasure. Oh, two. We're very exotic.
Us Italians like kissing. Thank you
All
very
right,
much.
cheers.
Bye-bye.
Just go through there, Mrs. Cowley.
I want to go to the toilet.
Oh, fair. I'll allow it.
I've been feeling
Poorly?
Yeah.
Yeah. Any high temperatures? Have you felt hot?
Yeah, she had a temperature this morning.
Did it wake you up in the night?
Yeah, as well.
What kept you awake?
In my throat.
Was it really sore? Okay. Shall we have a look at it? Come on then. Were you going back to school today? Is this a big drama to get out of school, do you think? It is a drama to get out of school.
Better not be, Halima.
No, in here. Let's have a look. Oh, your temperature's high. 38.3. Right, give me a big R. R. Oh, it does look sore in there. You go and sit down. So you have got a bit of an infection in your throat there. We'll give you some antibiotics and you can go back to school tomorrow.
Okay.
How's that?
Good.
Good for Dad.
Good.
It's funny how you've been well all through your school holidays and then the day you go back to school you get poorly. I believe you. That thermometer doesn't lie. Drink lots and lots of water because your lips look a little bit dry. We don't want you turning into a raisin, do we? What if you wake up tomorrow morning you're a raisin? Can't go to school then, can you?
Don't we?
Put you in some scones. That's a good idea. All right, darling. I'll see you next time. All right.
All right, mate. Take care. See you later.
No worries.
How are you?
Well, not so bad apart from my leg. The trouble is, you put up with it during the day, but I do stumble a bit with it. But it's at night in bed that's where it's worst.
Yeah.
You know, you get interrupted sleep.
So where exactly do you get this pain then?
Here. It's here mostly, but same as I come this morning, it's going down my leg. Yeah.
Shall we have a look at you?
Yeah.
You take your jacket off.
Yeah.
Do you live on your own?
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, 70 years, gosh. Oh, you must miss her.
I do.
Yeah. Do you think that keeps you awake a bit at night as well?
Pardon?
Does that keep you awake a bit at night too, or...?
It's getting up to sleep, you start thinking.
Yeah, yeah. Have you got family nearby?
Yes,
Can I untuck you?
Yeah.
I do think you look incredible for your age.
Yeah.
You're 93 now?
Yeah.
What's your secret?
Yeah, a pint now and again.
Good lad. Right then. Did you get out and do much walking?
Not a lot.
Did you get out the house at all much?
Yeah.
Yeah?
Yeah.
You got friends nearby? Good.
Yeah, yes.
Can you feel that?
Yeah. Just downside here.
More that side, yeah?
Yeah.
Just put your leg back down. So you feel it when I press?
There, yeah.
Yeah.
There.
Yeah, so it's right on the outside of your thighs here,
Yeah,
isn't it?
yeah.
It does definitely seem more pain in the hip, doesn't
Yeah,
it,
yeah.
that's causing this.
Yeah.
So I think best thing is to try and keep as active as you can. So a little bit of walking will help. Do you think when you're out and about it might help to have a stick? Have you got a stick?
Yeah, I have one.
Yeah, just so you can catch
Yeah,
yourself
yeah,
and just... What we don't want is for you to fall over, do we?
No.
Yeah. So there's this issue of the pain at night. Do you think it might help if I give you something that might help you sleep but might help a bit of nerve sort of pain? I'm thinking of a tablet called amitriptyline that might help you sleep. Should we give it a go?
Yes, if I can put my glasses on.
Oh, yeah, forgot about them. Good job you remembered, didn't it?
Thank you.
There we are. OK. So, I'll give you a ring in 2 weeks, OK? Any problems,
Thank you.
just let us know.
Right, thank you.
Give that a go and see how we get on.
Yeah, thank you.
But I think it's probably that hip, you know.
Yeah.
You've probably got a bit of wear and tear in it, haven't you?
Yeah.
It's had 93 years of use, hasn't it, eh?
All wear and tear.
You take care of yourself, all right?
Hi, I'm Linda Eves. How can I help?
I've just started last couple of weeks with having quite severe dizzy spells. If I'm rotating my head, I get quite dizzy.
OK.
Yeah, it's just causing me some issues.
Yeah. It sounds a lot like benign positional paroxysmal vertigo. Have you heard of that, BPPV?
No.
OK.
No,
It's
it's
big,
a good
big
one.
thing,
Yeah,
isn't
well
it?
done. Yeah.
Classically, it's sort of rotational movements of the head. It can be looking up or down or turning your head to one side, and it tends to then set off this sensation of spinning or turning or unease. Is your general health good at the moment?
I've just done the Yorkshire Marathon, so
Well,
I got
that's a
around
yes.
there OK, so I think I'm OK.
You're OK.
Yeah.
Let's check your blood pressure. It's fine, no problems with that. I'm 2/2/80.
Yeah.
Let's tilt that slightly that way. Great. OK, well, there's nothing in the ear canal that's causing any increased symptoms, and there's no signs of infection or anything. So if you're happy for me to go ahead, I can do what's called the Epley manoeuvre. So in the semicircular canals in your inner ear that are responsible for how you orientate and so on, they can get some little tiny crystals that form in there, which when they move over some little hairs with fluid, they create a sense of imbalance.
Okay.
And so the repositioning techniques help that.
OK.
Right. Ready?
Yeah, ready.
OK, down you go. OK, keep going, head over the edge, right down to the back. How do you feel?
Yeah, it's just wobbling a little bit.
Sit yourself back up. Have you noticed at home or whatever if there's one? OK, that's worse, isn't
That
it?
did it, yeah.
That did it. Are you ready?
Mhm.
OK, so lie yourself back. OK, right over here. How do you feel?
Yeah, that's doing it.
That's doing
Yeah,
it. OK.
yeah.
Turn over this way. Tell me if it sets it off.
Yeah.
Yeah. Oh.
yeah, right. And it's normal again now.
OK, keep turning your head a bit further over. That's good. Stay in that position. Turn your head a bit further forward. That's perfect. Were you OK like that?
Yeah, I'm good, yeah.
You're good. Bring your knees forward, so what you're going to end up sitting forward facing my desk. OK, how are you doing?
Yeah, I'm pivoting side to side rather than going...
OK.
Rather than it being dizzy. That's it, settle down.
Settle down.
Yeah.
That's quite quick. We'll get you back over in the chair.
Yeah.
You all right?
Yeah, good.
OK, up you get then. OK, keep looking there. Round over here. And sit down. OK. You can't drive when you've got symptoms of vertigo, so looking over your head and so on. Hopefully, with this repositioning now, things will be quite a bit better.
I think I'm at that age where I'm collecting things now. So it's, yeah, the eyesight went last year, the ears went 2 years before, so it's just waiting for the next thing.
Take a seat, my love. Who's this lovely lady? My mum. Right, what can I do for you today?
My throat is really sore and hurting.
She gets sore throats all the time. I just don't bring her every time because, you know...
I've had a look and see about a tonsil, you know, when we've seen her with it. Are you ready? Temperature first. Has she had a fever?
No, not that. No. She's only
Right.
been like it since weekend.
Right.
She came home from Dad's at weekend and said, "Do you know, my throat's really hurting."
Are you good at opening your mouth really wide?
No.
Have you got a cough or anything?
I have it
On a night I've heard a cough in you.
Open wide. Big R. This torch is brilliant.
Put your tongue out.
Bigger than that. Come on.
Do it.
Ah.
Open your mouth, Claire.
Good lass. Right, so looking at her temperature's fine. Her tonsils are very, very big tonsils, but there is no tonsillitis at the moment. Okay, so I've looked at her record and she had a nasty tonsillitis in July. She was poorly once.
Yeah.
This I don't think is a bacterial infection. I think it's a viral infection. It goes with a runny nose and a bit of a cough. When you get to about 12, 13, your tonsils often start to shrivel down.
Right.
A lot of adults don't have any. We look in the throat and we don't see any tonsils, and they've never had the tonsils out. They just go.
Yeah.
So I think we can plod on at the moment. Plenty to drink, paracetamol. You know, if she gets hot and poorly, or you'll know, because I know you're a sensible mum. She's sensible, isn't she, mum? Most of the time, eh?
Yeah.
So you know where we are if you need us. Keep plodding on. Get a bottle of water.
That's what I told you, just keep hydrated.
You young ones, teenagers, they don't drink, do they? No. You need to be drinking constantly. Drink now while you can. Me and your mother will be running to the toilet every 5 minutes when we drink a lot.
Definitely.
All right, my love.
All right,
Is that okay?
Yeah, thank you very much. Thanks.
Bye-bye.
Bye-bye.